Well, last year I had a stroke, so my neurologist gave all the medicines on board. But aside from that, he gave me this one, and I said, yes, I'll try. You know what? I'm very happy my neurologist gave me this to me, because I know because of NeuroAid, you know, my functional independence is very much improved. Had it not be, I think because of this one, I don't know, maybe now I won't be what I am right now. So thank you so much, NeuroAid. Thank you very much.
NeuroAid is a new pharmacologic agent that I've started using since 2008. And it has undergone revisions in its components up until we find NeuroAid 2 nowadays. And I use it for my stroke patients, particularly those with motor deficits. And remarkably, most if not all of my patients who have had severe motor deficits have recovered tremendously and functionality. I surely will recommend this to my colleagues in the business of treating stroke patients.
I've noticed since 2012, when we began prescribing NeuroAid, the stroke patients who have moderate to severely disabling strokes, there have been significant improvement when it comes to the activities of daily living. Or for example, those globally aphasic patients who have been using NeuroAid for a long time, when they come to the clinic for follow-up, regular follow-up, we would notice some changes like slowly comprehending and slowly or uttering some simple words, which somehow can be a significant improvement for them.
I've been prescribing NeuroAid to my patients since 2007, so it's more than 10 years, and it helped a lot. For my patients, they have faster and more complete recovery, and my confidence in giving NeuroAid to my patient was increased when the study, the ECHIMES trial, came out and it was effective.
So there was this particular patient na talagang I remembered because I was practicing in Medical City then. I just transferred kasi to the province around 5 years ago. So when I was practicing, I was a young consultant at the Medical City. So I had this patient who had aphasia. No? So parang hindi siya makakommunicate because of the stroke. It was she was previously functional. She was a retired school teacher, retired Filipino teacher, and then suddenly she couldn't even identify her son. So I said, wala namang mawawala, why don't we give it? And then the patient did improve. So nag-improve siya after a month. I stopped it. Okay, pwede na po siya. Maganda na siya. I tested all the cognitive functions. Okay, mga testing niya. And then, after another month, when I stopped NeuroAid, that's the only drug that I adjusted. Nag-regress ng konti yung clock drawing test niya. So parang hindi, pumangit ulit yung clock drawing. So, bakit ganon? In-stop ko lang yung NeuroAid, pumangit. I-resume ko ulit. So, nung ni-resume ko ulit siya, lower dose pero ni-resume ko siya. After another month, umokay ulit yung patient. So, that was the first patient that made me believe that there might be something to this drug. So, that's when I started giving it to patients.
The first time I actually used NeuroAid was when I was involved as an investigator in the 𝗘𝗖𝗣𝗜 study when I had my fellowship in Singapore. And the results of the studies only validated my personal experience when I started using NeuroAid in my clinical practice in Cagayan de Oro City. And it showed in my patients that there's improvement in the functional outcome, especially in the motor aspects. And these are subsequently been proven in subsequent follow-up studies like the 𝗘𝗖𝗣𝗜 study.
I had this 59-year-old female who presented with decreased level of sensorium. So she had a basilar artery occlusion which is a form of a stroke with poor prognosis. She was comatose for at least 5 days after giving anticoagulants and all the possible medications for basilar artery occlusion. The relatives and the family are very, very aggressive. So I tried NeuroAid because it was my last resort, and then I told them, let's try this medication. Who knows, it might work. Let's try this for at least 3 days to 1 week, and let's see the result. After 24 hours of taking NeuroAid, 2 capsules 3 times a day, the patient woke up. This is just the first 24 hours. The patient is still currently admitted right now, but we're very, very happy. The relatives are very happy, and even myself is very happy because we were able to give medication to this patient who has been comatose for 4 to 5 days. I'm very excited about the result, and I hope this will help the patient in regaining her consciousness and her ability to work again and to be productive in the community.